All right, well, I'll go ahead and get started. We appreciate those who showed up on time. And Eric, you're our Zoom jockey, so you'll be there letting people in as we move along. But welcome everyone to the second day of the Leadership Summit, DBSA's Leadership Summit. We are glad you are here, and we're hoping that you will find the week an enjoyable and productive experience for you. My name is Phyllis Foxworth, and I serve as the Advocacy Vice President for DBSA. And you are at the session, How Peer Support Models Valuable Steps in the Lived Experience. And just a little background for you, the way the advocacy team set up the advocacy track is that we selected topics for each day. So today's topic is all about peer support and peer support services. So in addition to my session, afterwards, Douglas Halst will be giving a session on a strength-based approach, how peer specialists improve the shared experience of peers. And then there will be a great panel discussion following that on the effectiveness of peer support in mental health recovery. And that's going to be, on that panel is going to be Dr. Karen Rentis from Mission Hills, California, who leads up the behavioral health clinic there. Dr. Megan Mayberry, who leads up the peer specialist program at Hines VA. And Dr. Chip Reynolds, who is a well-known researcher in the area of gerontology and has done a lot of work with our demonstration projects with peer support specialists. So I hope that you hang around for the entire suite of sessions that we have today. I think they're going to be really fun and informative. All right, but let's get started with the session that I am presenting today. And it's, as I said, this is How Peer Support Models Valuable Steps in the Lived Experience. So just kind of to set the stage for what we're going to talk about today, broadening the adoption of peer support and peer support services is the cornerstone of DBSA advocacy. So when developing advocacy strategies, personal stories are crucial. We all know that. But it's just as important to be able to articulate the value to influencers and decision makers in a research-oriented format with supporting metrics. So, and that's the focus of this session. In this session, you'll learn how we define value, understand the metrics for defining the value of peer support and peer support services, and I'll share tips on how you can spread the word about the value of peer support and peer support services. So just again, for those of you who weren't here yesterday, before we get started, I want to share that in order to make this session interactive, I'm sure we all have experienced Zoom fatigue, we'll be using Slido to give you the opportunity to share your thoughts throughout the session. If you know how to scan the QR code, you can do that now. Otherwise, if you prefer, you can go to slido.com. If you do, you'll see a screen that looks like this one. Please enter advocacy track, no spaces, in the blue box at the top of the screen that says joining as a participant, enter code here. So in this session, you'll have the opportunity to provide short answers to questions. For that reason, you may also decide to use slido.com instead of the QR code if you prefer typing answers on a computer keyboard rather than on your phone. So whether you scan the QR code or go to slido.com, the next thing you see is a list of days and times. These times are all Central Time. So again, my name is Phyllis Foxworth. Please select Tuesday and the time that it is here in Chicago right now, which is 3 o'clock. And the color code is green. So hopefully that gets you to the right Slido. After you selected today's date and time, you can check that you are in the correct day and time at the top of your screen. That should say 3 o'clock, which is what the time is here in Chicago. You can also click on that to change the session you're in if you accidentally selected the wrong date and time. All right. So as I said, during this session, we'll be discussing how we measure and define value. But before we get into defining value, we need to define what we are measuring. So there are two different types of peer-to-peer activities that we're going to focus on today. The first one is peer support. An example of this is a DBSA support group. In these meetings, people with the shared experience of living with a mood disorder come together to provide social, emotional, and informational support to each other as equals. Peer support services, on the other hand, define a range of activities provided by a trained state-credentialed peer specialist. So these paraprofessionals use their lived experience of recovery and wellness to assist another in developing their own wellness goals, creating strategies of self-empowerment, and taking concrete steps toward building a fulfilling and self-determined life. These services are often provided at a variety of healthcare settings that can include primary care offices, emergency rooms and hospitals, mental health facilities, recovery centers, and inpatient facilities. They may work steadily out of one of these healthcare settings or travel among several different locations. Many peer specialists, for example, work with the homeless population. They may also travel to meet the clients at their home or work with them over the phone. And that's what we've had experienced a lot during the COVID, is people are getting virtual peer support services. Okay, so now that we've defined the two different types of activities we're going to be discussing today, I want to share with you some definitions of value. So value can be defined as the relative net worth or merit of something, the importance of something, such as the value of a high school diploma or the value of a queen, in chess. Value can be defined in monetary terms, such as the value of a piece of land. Value can be defined as the worth of something in terms of what things can be exchanged for something else. And finally, value can be defined as equivalent worth, to give value for value received. So for our discussion today, we're going to focus on just these three definitions of value: net worth, something exchanged for something else, and to give value for value received. So using these definitions of value, let's think about the value of peer support. First, what's the merit? So specifically, what's valuable to me that I'm receiving? Next, amount of other things for which it can be exchanged. For example, exchanging negative aspects in my life for positive ones. And then giving value for value received. An example of that could be, that my participating in a support group meeting helps me in my own recovery. Okay, so let's have our first audience interaction. Using Slido, answer the following question. And this can be a text, it can be, a free text. It's not, a short answer, not a paragraph, but just, a short answer. When it comes to peer support, and again, thinking about the definition of value that I just reviewed, what are you receiving of value from peer support? And is the Slido active and working? Yes, okay, very good. I start to see some things coming up. All right, some other answers coming up maybe. What are you receiving of value from peer support? All right, these are some great examples of value. And I think that as we get into our discussion, and keep on writing, education, that's a great one too. I don't feel alone in my experiences. All right, we're going to come back, think about these. We're going to come back to these later on as we continue to talk about value. So the next question is, and this is just, I'm going to build a word cloud here. So just take, maybe type in one word. So again, thinking about value, please take a few moments to share at the Slido site just a single word that describes what you've been able to provide of value to others when engaging in peer support. experience, acceptance, compassion, comfort. And so you can see the word cloud building that, compassion and lived experience, what you're providing to others. Definitely we think about peer support as the value of the lived experience. All right, so I'm going to ask you one final question. So thinking about your answers and your responses to the last two questions, are you able to quantify what you've received? Interesting. Well, oh, great. Some people say absolutely. Yeah. All right, we'll let this build for another second or so here, see if there's any other responses out there. So this is really interesting. And, what I'm going to share is that during this session, I'll be providing ways researchers have quantified the value of peer support and peer support services. So as I do that, it might be helpful to keep in mind your own ideas on value, as well as the ideas and thoughts that others have just shared in the last few minutes here. So as I shared earlier, when sharing value with influencers and decision makers, it is important to be able to quantify that value with solid research. And since we're talking about value today, it's only appropriate that we take a moment to describe what is the value of research. So when sharing research about the value of peer support, for example, you help build knowledge and facilitate learning among those influencers and decision makers. You're able to disprove lies and support truths about the value of peer support. And just as important, once you've gained this knowledge, you're armed with resources to strike when the opportunities arise. So you have the resources to facilitate learning and share truths. So the first area of research we'll discuss this afternoon focuses on the value of peer support groups. So just to gain a better understanding of who we have in the audience, great, you're answering it already. Please take a moment to answer this question found on this page. Have you ever attended a support group meeting? So a lot of you have, that's great. So you'll understand, some of the value of the research that we'll talk about. And I do have just one other question. For those of you who have said that you have attended a support group meeting, what was the longest period of time you attended that meeting? More than a year, okay. So it's interesting that I'd say for a moment there where there was complete equality between all the other answers and more than a year. But so it seems like the majority of people say they have been attending more than a year or at least 3 months. So what does the research tell us about the value of peer support groups? In general, research shows that support groups have similar benefits to group therapy. Participating in a support group instills hope and a sense of altruism among all the participants. I shouldn't say all the participants, but among the participants. It's also found to be a cathartic experience for those that are participating. So one way researchers have quantified those outcomes is by stating that people who attended just a mutual aid group and received no other intervention for 1 year were less likely to be depressed and had more friend resources. So that's a way that one can quantify the value of a peer support group. So, what about DBSA? So that was in general. That's just some general research. So let's talk about DBSA support groups. Several years ago, Pepperdine University conducted research with participants of DBSA's National Online Support Group program. They used several different recovery assessment scales to measure the outcomes. The results showed that participants were better informed about their mental health condition, had better acceptance of their mental health condition. They were more confident about their treatment. They expressed optimism about and control over their future. So it doesn't really surprise me that if I feel more confident about my future and more optimistic about it, my self-esteem is going to tend to be high as well. So the next area of research focus we'll address in this session is around peer support services delivered by a credentialed peer specialist. So using SAMHSA's definition of a peer specialist, through shared understanding, respect, and mutual empowerment, a peer support worker can help people become and stay engaged in the recovery process and reduce the likelihood of relapse. So, can we quantify that and can we prove that with research? So, these services delivered by state credentialed peer specialists, just to be clear, do not take the place of clinical services delivered by psychiatrists, therapists, or social workers. Rather, they serve as an adjunct to those clinical services. And as a peer specialist, by using their own lived experience, which is one of the values that many of you shared in that word cloud, so using their own lived experience of recovery, they promote connection, and that again showed up in that word cloud, didn't it? The word connection. They promote connection with the peer they are working with and inspire hope in the peer. It should be noted that this peerness offers a level of acceptance. Again, I saw that in that word cloud, acceptance, a level of acceptance, understanding, and validation not found in many other professional relationships. So this is a key, having the peer services delivered by a peer specialist can be extremely important to the overall delivery of mental health services. And it's a key advocacy goal of DBSA's. So we want to broaden the adoption of peer support services as an integral part of the delivery of the overall mental health care, the package of care that people are getting. Once again, before we can define the value of peer support services, it's important to define the concepts. So for our purposes, we will be looking at engagement. And this refers to the relationship between the person receiving clinical care and the healthcare system that's providing the care in terms of establishing well-being outcomes. Activation refers to the ability of the person receiving the care to feel empowered to take charge of their own health and wellness with the support of the care team. And then recovery refers to a person's ability to effectively manage one's mental well-being. And then finally, we're going to talk about utilization. And this refers to the direct cost to the healthcare system to deliver the care to the patient. So first, what does the research tell us about the value of engagement with regards to peer support services? First, we learned that people who participate in peer support services have an improved relationship with their mental health care providers. Now, this could be because these individuals are better engaged in their care. So it just naturally makes sense that if someone is engaged with their healthcare providers and their own care, they're in a better position to manage the healthcare system. So let me give you an example of that. If I have a good relationship with my clinicians and I'm invested in my own care, I'm more apt to take the initiative to ask questions about navigating the healthcare system, such as understanding how to make appointments and how to utilize the resources that are available to me through the healthcare system. And so this is where that peer specialist can be instrumental. They're instrumental in understanding the challenges that the peer might have navigating the system because they've been there. They were there at one time. And so they can assist them in tearing down self-imposed or system-created barriers. So a quick reminder of our definition of activation. This refers to the empowerment a person feels around taking charge of their own care. When participating in peer support services, the peer feels that the overall mental health care treatment they are receiving is responsive to their own unique needs. And they demonstrate increased engagement in self-care and wellness. This has been measured by an increased score in recovery tools or skills that measure empowerment. An example of this would be the ability to either initiate or more actively participate in shared decision-making with the clinical care team. So what's the role of the peer specialist? Working with the peer specialist, they could discuss how to initiate these conversations with the care team and then be empowered to share with the team when the treatment plan is not meeting their needs and their own unique defined treatment outcomes. So think about it this way. It's the difference between being on the receiving end of care being offered, of the care that's being offered, or being empowered to own your care and determine the appropriate treatment outcomes that are tailored to meet your own unique set of goals. So recovery is an important concept when thinking about well-being. It means different things to different people. There's no one definition of recovery. For some people, recovery means aiming to be symptom-free. For others, it might mean managing their mental health so as to be able to live a full and meaningful life as defined by that individual. Recovery within the NHS mental health system is often referred to as the recovery model. This model highlights the importance of building the resilience of people with mental health problems. So people often talk about clinical and personal recovery. So let's take a moment to define what clinical recovery means. Some doctors and health professionals think of recovery as no longer having mental health symptoms or a reduction of symptoms. While dealing with symptoms is important to a lot of people, DBSA takes a much broader view of recovery that goes beyond the clinical view, which means being able to live a full and meaningful life as defined by the individual. So the clinical team should support you in achieving your self-defined recovery goals and what you think is important for your well-being. And so this is what is known as personal recovery. So it's been shown that participating in peer support services has demonstrated that it can improve recovery. Individuals have an increased sense of hope, self-esteem, and confidence. They experience a sense of control as well as an ability to bring about changes in their life. Changes that reflect their own personal definition of recovery. So when sharing the value of peer support services with influencers and public policy decision makers, it's often important to share with them the economic value of these services. Well, I'm sure, including me, while we may want all of our public policy decision makers and influencers to have as their number one goal improved outcomes for people, we can't discount their needs around fiscal responsibility. That's just part of the reality, folks. So managed care organizations that are known as, we may have heard them called MCOs, they provide mental health services under state contracts. They've known for a long time the value of peer support services. And they've incorporated these services delivered by state credentialed peer specialists for years. The Center for Medicaid and Medicare Services also recognizes the value and allows state Medicaid programs to bill for these services as long as they're provided by a state credentialed peer specialist. So, in talking about the economic value, one MCO reported in a white paper that they had written some of the results that they've achieved providing peer support services. They achieved a reduction in mental health hospitalizations over a 5-year period, a reduction in hospitalization admissions over a 30-day period, and inpatient days that were below the state average. Overall, this MCO reported a reduction in the reliance on formal services to the people that they were serving, while at the same time achieving the same positive recovery outcomes. So confirming the value of peer support is key, as I said, is key to our DBSA advocacy strategy of broadening the adoption of peer support services. In 2020, DBSA implemented 3 different demonstration projects that enabled us to capture this value. While not formal research, the metrics captured during demonstration projects lay the foundation for applying for formal research grants that can capture the value. Once a research program is completed, the researcher can write a formal paper to a peer-reviewed journal. Once published, this paper is available to other researchers and can be used to make a more formal case to the influencers and the decision makers. So today, there's not a whole lot in the published literature about the value of peer support services. So that's why these programs are extremely important, because they lay the foundation for us to apply for research grants. So in the next boards, I'll provide a high-level overview of the 3 DBSA demonstration projects. The first one was a program that provided community-based peer counseling to seniors in partnership with a clinic that is part of a major healthcare system on the West Coast. And as I said at the later presentation today, that the woman who is running that program, Dr. Karen Rentis, will be a panelist and we'll be talking about that. The second program, a demonstration project, also focused on seniors. And the target population were seniors attending a DBSA online support group. They were also then offered one-on-one peer counseling as an extension of that program, again by a credentialed peer specialist. The third program was made available from a SAMHSA ECHO grant that was administered through the National Council of Wellbeing. So we were pleased that these services for this grant, we were able to offer them to chapter members and participants from our support groups. So before I get into research, I'm just curious, again, who's in the audience here, have you ever received peer support services as part of your mental health care? Interesting. So, it could, that could be that you may not have recognized that that's what you were receiving, or that you were not in programs where that was offered to you. And that's one of the reasons why our advocacy is so important, that we broaden the adoption of peer support services. And so I will probably skip this next question then, because I was going to ask for those of you who had received peer support services in the past, what was the value you received from the peer support services? But so far, all of you said that you are not aware that you've received peer support services as part of your mental health care. So while all of these demonstration projects were slightly different, there was consistency in the community-based peer support counseling that was provided. The peer specialist scheduled a weekly meeting with the peer. Each meeting began with the peer doing a self-assessment with the PHQ-9 tool. So the PHQ-9 is a 9-question scale that asks questions about one's level of interest in doing things. It asks questions about their mood, such as feeling down or depressed. It asks questions about their physical symptoms, such as difficulty with sleeping, energy levels, eating habits. Other concepts in the PHQ-9 include their self-perception, their ability to concentrate, their speed of functioning, as well as thoughts of suicide. So responses to each of the 9 questions in the PHQ-9, the responses range from 0, not at all, I'm not experiencing this at all, or 3, which is nearly every day. So I'm experiencing this nearly every day. So asking the peer that they were working with to do the self-assessment with the PHQ-9 enabled the peer specialist to have a jumping off place to start their conversation for that day. And it was also an opportunity for them to recognize, because they were doing this every week, to recognize areas where there had been self-improvement, where they were making progress towards their well-being. So the first demonstration project concluded this past June. It was initiated as a 3-year grant from the Archstone Foundation. Implementing this program involved a partnership with FACey Medical Center in Mission Hills, California. And FACey is part of the Providence healthcare system. So in this partnership, seniors were enrolled in the DBSA's Senior Strength Program upon referral from a clinician at the clinic. So before the pandemic, all the seniors were seen by their primary care physician, were screened with the PHQ-9. And then a score of 10 or higher triggered a protocol for the behavioral health therapist to come to the exam room and do an evaluation. At the conclusion of the evaluation, if appropriate, the patient was invited to participate in the DBSA Senior Strength Program. Now, due to COVID, modifications to the program were initiated, and the initial referrals were no longer coming from the primary care physician's office. But nevertheless, the program remained the same, that the individual was referred from the behavioral health therapist at FACey and invited into the DBSA Senior Strength Program. In this program, the peer specialist then met twice a month with the medical supervisor at FACey to discuss the cases and coordinate care with the behavioral health team. During the course of the program, 69% of the seniors that were referred from FACey enrolled in the program. Of those, 88% stayed with the program for 3 or more counseling sessions with the peer specialist. Those who stayed in the program and graduated had an average 59% reduction from that initial PHQ-9 score that was taken at their first visit. So that's pretty significant. So in March of 2020, when COVID caused major changes in the way peer support was provided, DBSA used funding from the Retirement Research Foundation to reach out to seniors who were experiencing feelings of isolation. We implemented 3 national online support groups just for seniors. At the conclusion of each meeting, the participants were offered the opportunity to request one-on-one peer counseling from a peer specialist. The peer specialist met with a DBSA medical advisor monthly to discuss the work they were doing with the peers. And that person, Dr. Chip Reynolds, will also be on that panel this afternoon. So you can see where these things all tie in together. So they met with him twice a month to seek advice around the services that they were providing to the peers. The program began in June of 2020 and concluded in March of this year. 19 seniors took advantage of the one-on-one peer-to-peer services provided by the peer specialist. 89% of those who had requested the services worked with that peer specialist for 3 or more visits. And among those who had 3 or more visits, the average decrease in the PHQ-9 score was 36%. Again, still a very significant drop in their PHQ-9 score in a very, very trying time for people. The next demonstration project was very short-lived, but also produced positive results. This grant was focused on addressing the mental health challenges brought on by COVID. We were well aware of the stressors and challenges our chapter leaders were experiencing transitioning from in-person support groups to virtual. Our compassionate and chapter leaders were advocating for the members of their community by taking on this Herculean task of learning how to use Zoom and communicating with participants in ways they never had. So when we learned about this opportunity from the National Council for Mental Wellbeing, we immediately applied for it to provide one-on-one peer counseling to our chapter leaders. 17 chapter leaders enrolled in the program. Because of the requirements of the grant, only 5 peer counseling sessions were available. But of those who enrolled in the program, 88% continued with the program for the entire 5 weeks. And the average reduction in the PHQ-9 score for these participants was 47%. So again, a very significant drop in what is a major scale used by clinicians on measuring depression. So as I stated at the beginning of our session, broadening the adoption of peer support and peer support services is at the foundation of DBSA advocacy. When thinking about our own advocacy efforts, I encourage you to think in terms of building knowledge and facilitating learning among family, friends, and colleagues, supporting understanding of peer support and increasing public awareness of its value, looking for opportunities to disprove lies and support truths, and finally, finding, engaging, and seizing opportunities to share the value of peer support. So following are some tips to incorporate what you've learned today about the value of peer support. A great way to practice what you've learned today and build your confidence is to have conversations with family, friends, and colleagues. Start small. Pick 1 or 2 things you've learned today and become familiar with these metrics. Be sure to download the session when it becomes available. It contains usable statistics as well as the sources of these statistics. This will enable you to write letters, make phone calls, or even visit your elected officials. Share with them how peer support and peer support services improves outcomes for people living with mood disorders. And just as important, share with them the economic value. Another great way to influence public opinion is to write letters to the editors or op-eds to newspapers or periodicals. If you are a chapter leader, sign the letter as a chapter leader in your local chapter. These letters can build support in your community for funding from your local, county, or state mental health boards. This strategy allows you to seize the opportunity when it arises. So I've got just a couple more Slido questions for you. The first one, did the material presented today provide you with the confidence to share about the value of peer support? Well, that's good to see. That's great. I'm glad. And like I said, and you know, definitely download when it becomes available so that you can get these statistics. And then my next question is, how likely are you to speak out about the value of peer support? Since you all said that you got value and learned something today, how likely are you to speak out about the value of peer support? Oh, that is fantastic. So again, I encourage all of you when it becomes available to download the presentation, because not only are the statistics there, but it's just as important to have the sources. You know, when people say, well, you're just saying that, you can say, I have the source. This was the research that was done. And everything that we presented today is credible research that can be found in a peer-reviewed journal. I think we have a few minutes left for some questions, do we not, Andrew? Or Eric, Eric?
Yes, we do. And I have so far one question, and I hope others will join in. Could you tell us where to look up the recovery assessment scales done by Pepperdine, or just describe those scales in a little bit more general sense?
Sure. You can, you know, I'm actually doing it for a different project, which if you come back on Thursday, I'm giving a session talking about treatment outcomes, peer preferred treatment outcomes. And I'm actually doing that project right now where I have, through some systematic literature review, identified 9 different scales that I can stop the share screen.
I just did. I just did.
Okay. So I've identified 9 different scales that really talk to the types of recovery scales that people are interested in rather than symptom-based scales. And why is that important? Because clinical trials typically use symptom-based scales rather than these things that are important to us around recovery. So if you just Google recovery assessment scale, it's free, it's available, and you can download it. And you know, I'm happy to even, you know, if somebody wants some more information about these types of scales, you know, feel free to drop me an email, and I'm happy to give you a list of other scales that you can take a look at. And because they're all free and they're available for people to download. In fact, maybe what a better idea, maybe why don't we just post them with as part of the work that we're doing here, with when we post this presentation.
Yeah. Can you say a little bit about some of the sort of alternative places that peer support is provided, peer support services? You know, I mean, we hear about in the hospital or in the you know, the mental health clinic, but are there some other places that people get peer support?
Sure. You know, one of I'm going to not do him justice, but there is a well-known advocate in the New York area. I think his name is Harvey Rosenthal, who has been a pioneer in peer support, providing peer support services. And he has always held the belief that it is the role of the community to meet people where they're at. And that peer support specialists be out in the community, meeting people where they're at. And, you know, I strongly, you know, I can't agree with that it's whether you're meeting someone, you know, the homeless population, then it's not right to be asking them to come into the clinic for services. You need to go to them. Another example of that is that prior to COVID, and I'm sure that this will happen as the pandemic lessens, well, actually it's true that the libraries have opened up, but even before the pandemic, libraries were finding themselves as beacons for people with mental health challenges. And the librarians were saying, we're not equipped. That's not our job. It's not that it's not our job. They're saying, but we're not equipped we haven't been trained to do this. And that would be a great example. That's a great place where peer support specialists could be. I know large cities looking at this as a challenge. We're planting social workers at their libraries. And it's not because that it was that, again, it goes back to the idea of meeting people where they're at. So if people with mental health challenges are showing up at the library, then let's have services at the library. Let's have peer support specialists at the library who can meet with them. Another great place that have cropped up in the last 5-6 years are called living rooms. And there's some great research around the value of living rooms, that instead of going to the ER, a person can go to a living room, and it's just, you know, it could be a place that's intended to look cozy and comfortable, like one's living room, and you just drop in. And there is peer support specialists there that are available and there to talk to the individuals. Research around living rooms has showed the value of diversion from the ERs is very high when you have a living room in the community. So those are just a couple examples of where peer specialists might be providing those services outside of the healthcare.
Right. Another question we've got. I've got a couple of questions here. How do we, who are peer support challenged individuals who say that CPS is not professional, how do we deal with the issue of that peer support professionals or peer support providers are not a professional around?
Well, I think that that's part of the advocacy that DBSA, why we feel so strong about that, and that's why we feel so strong about the research. That you build credibility by being able to demonstrate the value. And when when you can have conversations and show this is the value that these services are bringing, that raises the credibility of that profession. And when you raise the credibility of that profession, you're raising the professionalism as well as the acceptance of that profession. So, I encourage you to take ownership of it yourself. If you're a peer specialist, arm yourself with the facts and go out there and be public and be available and talk to public about the value of peer support services.
Can you say a little bit about what it takes to become a peer support specialist and certified? Where do you, how do you make this happen?
Sure. All states in the United States except 49 states have a credentialing requirements to become a peer support specialist. They differ by state. At DBSA, because they differ by state and they can change, we don't keep a library of what the requirements are for every single state. That would be overwhelming for us. But I can share that they all have some general characteristics. You're required to take a course. DBSA provides a peer specialist course. It's a 76-hour course offered over it's a hybrid course that is independent learning as well as a group learning experience for 1 week. So all states have that requirement that you take a course. And it starts to differ after that. All states have a requirement that you have supervised experience. For example, in the state of Illinois, it's 1 full year, it's 2,000 hours. And then you take an exam. All states have a requirement that you take an exam. So you take the training, you get the supervised experience, you submit your application, and that enables you, once your application is approved and they say, yes, you meet all the requirements, then you take the exam. And that's the typical pathway to becoming a peer support specialist.
Well, thank you very much. We've got 2 minutes here. I think we had one more question just come in. Would you suggest a peer support specialist do peer support, such as support groups outside of the mental health organization, if the community needs and the mental health institutions in the area do not provide it?
That's an interesting question. As I said, all of our demonstration projects, all those peer specialists met with a clinician as part of the program. So with the FACey program, they were referred by the behavioral health therapist, and those individuals were continued to be seen by the clinic. If they weren't, they couldn't participate in the program. The same was true of our online support. We had Dr. Chip Reynolds, who we'll be meeting later today, who is a well-known researcher in gerontology. He was there and met with the peer specialist every 2 weeks where they could review the cases. And the same was true with our ECHO grant. So, I think that we believe that a peer support specialist is part of the overall package, a quality package of mental health services that are provided. All right, I think that we are.
I think that's it. We are at time.
I would say that concludes our session for today. I want to thank you for being here and hang around for the other sessions.